Policy. Sorry. Welcome everybody to the Board of Health meeting. We have a policy about public participation. I want to make sure that everybody who wishes to speak, please just sign in and give us a name and a phone number, address, or email address so that we can reply if we need to answer a question. Answering questions though in the meeting is not something that's going to be going on. Comments, absolutely, but trying to get back in details and stuff like that. That's why it's much easier to respond to something via an email reply if it's needed that way. So please sign in if you would like to do that. We're going to try to limit, though, I'd like to try to limit the public portion to 30 minutes. Everybody gets 3 minutes to speak. Part of it is that we are in another facility and then we had a timeline as far as they're allowing us to use the place, courtesy, but there's a timeline, a deadline at the time of night where they'd like to be out of here by around 8 o'clock, which is what they're after. So with that, I'd like to welcome everyone and let's have a roll call, please.
Dr. Akers?
Yes.
Mr. Flora?
Yes.
Mr. Watson?
Yes.
Mr. Ryan is excused. Ms. Cody? Yes. Mrs. Witt? Yes. Mr. Watson?
Yes.
Dr. West?
Yes.
And Dr. Witt?
Yes. With that, join me in the pledge allegiance. I pledge allegiance to the flag of the United States of America, and to the republic one nation under God, indivisible, with liberty and justice for all. I think the first thing I want to go through is that last meeting we had a request that we consider using voice votes versus roll call and everything. And we went and asked the legal counsel what was required, what the rules. Basically, he said you really need to only do a roll call on if you go to executive session. Otherwise, a voice vote can be done on items to make decisions. At any one point, though, anyone who wants to have a roll call taken after a vote, you're allowed to call it. So that's the way we proceed unless somebody has an objection with that. Okay, thank you. Okay. Approval of the consent agenda, the first item on our meeting minutes here. So we got the October board minutes, the program report from WIC, nursing section, the environmental health section report about the landfill, health commissioner's activity report, and the health planning promotion section report. So we got those 6 items that are in that. Is there any discussion or questions concerning any of those? Having heard anything? Can I get a motion?
What that means again for the
Oh.
1H. On the line.
7,500 tons.
Per day.
That's a per day. Yeah. Any other questions?
When you go over the report later, and that, maybe with some of the discussions from the.
All right. Thank you. Anything else? Putting the consent agenda. If not, can I get a motion? Concerning the consent agenda item approval. We'll move. Second. Okay. Everybody in favor? Any nays? No. No nays? Everybody voted yes. Okay. Everybody okay with that? Okay. At any point, if you feel uncomfortable, need a roll call, we will do it. Thank you very much. Next action and discussion of mine is the health commissioner's report.
Okay, and I've got a variety of things to provide updates on. From a personnel standpoint, I'm pleased to share that we filled one of our 3 nursing vacancies. Sarah Klaus begins next Monday, December 19th. And we continue to seek applicants for the other 2 full-time nursing positions. We have an interview scheduled next week for the full-time epidemiologist position. Originally, we had advertised that as a part-time position, but then received additional funds or requested and awarded additional funds by the Department of Health. So We're looking to fill that as a full-time position now. And we're preparing to post the health educator position, the health educator one position that does the naloxone program, because we received notice from the Ohio Department of Health that our funding for next year is being continued. So we are both going to proceed with posting that position. We've been holding off until we knew. From an operational standpoint, I wanted to let you know that I presented at the commissioners meeting regarding our lease agreement. We're on a 3-year lease agreement for our building that expires December 31st. And so I requested a renewal of that 3-year lease, but with some modifications because the square footage that we will be inhabiting will change with the changes to the building. And so the commissioners are currently having the administrator to come up with the current cost per square footage, that kind of thing. And the request that this changed footage. So they'll be coming back public early in the next year. So they requested that we continue basically on a quarter by quarter basis at the current rates until they've got something to propose to us. Related to the construction, there actually is progress being made. The brickwork has been fixed. The ductwork has been moved that went through the middle of the wall, outside the wall, and they roughed in the new handicap accessible entrance that's 2 doors wide, as it should be. And the electrical contracts are going to be on site tomorrow, shutting off the power so that they can start to move power to be able to put in the windows that are planned. But it means that they'll be shutting off power to, they don't know how much of the building. So literally what we're planning to do is reporting to work as usual. And once we find out who exactly is impacted by the power outage, then we'll know who we're going to try to have work in the field solely, work from home, or try to move their their desktop system or else in the facility. That's tomorrow, Saturday, and potentially Monday as well, depending on how it goes. Public health related kind of update, just wanted to highlight what's happening nationwide related to influenza. We're seeing much earlier peaks or increases in hospitalizations than we normally see this time of year. The CDC reports that it's high across the entire country. The cumulative hospitalization rate is higher than the rate observed for this point in the flu season or every previous flu season since 2010, 2011. And that the majority of influenza viruses that are tested are in the same genetic. They're the ones covered by the flu vaccine. So, so it's a good match this year. And all the viruses collected and evaluated so far are susceptible to the influenza antivirals that are available. However, there is concern that there may be a shortage of the most common antiviral because of the increased number of hospitalizations. So CDC has already put out advisory information for hospitals and outpatient settings to consider when to prioritize the use of the most common type of antiviral versus other types of antivirals. So, so it's as I've said already, this is an interesting flu season. RSVs as well among pediatrics. There's been 21 pediatric deaths in the nation so far, 7 in the last week. Related to other access of operations, our nursing department and the clerical staff in their department completed training last week on the electronic health record that we're implementing, and they went live on Thursday. So it's been a learning experience so far, but they've been doing very well. And we have access to this through the collaborative, the local public health services collaborative that you approved for the health district to join last year. That gives us access not only to an EHR that has integrated billing, but also allows us access to all the contracts that they've negotiated, takes care of the credentialing, the contract negotiation, et cetera. So in the collaborative, it's all health departments that are part of that function as one practice with multiple locations. There's over 30 health departments that are currently part of the collaborative, and there's a list of about 12 more that want in next year. So it keeps growing. one of the board's responsibilities and the health district's responsibilities is assessing and monitoring the health needs of our county. And so yesterday you received an email about the Health Alliance's release of the 2022 Community Health Status Report. We're inviting you to share that with anybody you want. There's video recordings of covering the specific portion. So there's one covering the adult portion or the adult results, which is conducted via a randomly selected sample of adults here in the county. And then there's a youth section, which reflects the results of the OES survey that's done across the state. And that's actually done through, not through the Ohio Department of Health, but actually through the OMAS, the Ohio Department of Mental Health and Addiction Services. And then a third portion that covers the survey methodology itself. So there's a survey, there's a link to a survey at the end of that to get feedback from individuals. That information will then be incorporated into the final report. So that's an opportunity for community members, agencies to say, wow, this really surprised me in there. I thought I would see, or I thought I would see X and I didn't. You know, what do, you know, after viewing the information, what do you view as the most important issues to address? Those kinds of things. So it's a short survey requesting feedback from individuals that have viewed any part or all of those recordings or read the reports. So that's available on our website. And then the final piece, let's make sure I got this right. So the final piece I have is related to the proposed 2022-2023 license conditions for Sunny Farms landfill as a municipal solid waste facility. I have several here things here for you. One is in your packet. You'll notice there is an email that was sent by the Residents Against Trash Patrol, because there were several board members that were not listed and did not receive it. So it was included in your packet to ensure that you all did receive that. And then the process that we went through is we actually started from the basis of the presentations that were done earlier this year by both the solid waste and air quality consultant, as well as our legal environmental health legal consultant. And basically starting from the premise of the 4 avenues that Joe Durham had presented. You know, the first being that the Board of Health can submit written comments to EPA now regarding an increase in the what we call the AMDWR, the authorized maximum daily waste receipt. That we could, and we did that, then that the Board of Health could submit written comments later after a draft permit is issued, which we can still do. That just hasn't occurred. There has been no draft permit issued at this point. That we could work directly with Sunny Farms landfill by developing agreed upon terms and conditions, which we have not done. And then the fourth one was adding certain terms and conditions to the operating license for 2023 that are both legal and reasonable. Those are terms that comes directly from statute. They have to be both lawful and reasonable, which he addressed that in his presentation. So we've been working since, well, really since Joe's presentation. We started with our landfill, the solid waste, and the air quality consultants creating a draft set of conditions that then legal counsel looked at and we reviewed together over the course of multiple meetings. And some of you were able to attend those meetings as we worked through the details of, you know, what certain parts, what they meant, where they came from, what was the premise for them, what was the lawful and the reasonable aspects of those. And so what you have in your packet are the final version of the proposed license conditions. They run in 3 sections, basically. So the first one relates to compliance reporting. The second section, which is the largest section, relates to conditions addressing nuisance odors and compliance with Ohio Administrative Code sections 3745-27-19, sections B3 and B5, which relate to solid waste or municipal waste facilities and air quality kinds of things. And then the third section relates to conditions addressing compliance with Ohio Administrative Code 3745-27-19L related to requirements for a PCB and hazardous waste prevention and detection program. So as I noted, these were originally written by our consultants. And then as we worked through the details, there were numerous revisions that we made to them during the course of our meetings. So in the first section, basically we're suggesting license conditions that relate to complying with the sections of the partial consent order and final judgment entry that relate to the air quality standards. They already report results of many other sections of the consent order, but we do not currently receive the air quality because we are not currently, we don't have any say in the air quality aspect. However, it does relate back to nuisance odors or odor nuisances, whatever way you want to say it. And so that's why we propose putting that in there. And we've addressed one challenge that we've experienced this year. The consent order is very specific and addresses what happens when the monitoring system exceeds 15 parts per billion within a certain time frame, but it only applies to one type of the monitoring equipment and not to the other type. And so we've added 1E that would address both types and what's the time period they need to notify us within. Because the consent order is currently quiet or silent on whether notification is required to the health department and what time frame that's required in. So what we're proposing is anytime that it exceeds 15 parts per billion, they notify the health district within 24 hours via an email that is sent to the health commissioner and the director of environmental health. In the second section, this relates to nuisance odors and compliance with this particular section of code, which is an air pollution control section that reflects what's in the federal regulation as well. And so some of these portions are things that are already in place, but it's getting the reports for those sections. So, you know, continuing the maximum daily waste receipt, not to exceed 7,500 tons of total waste daily, including both municipal solid waste and construction and demolition debris material. That the open and closed flares will be operated with a flame present at all times when gases are being vented to them, and that the presence of a pilot flame shall be monitored basically at all times, that it will be maintained. And if it goes out and doesn't relight, then an alarm would sound. And then the next two sentences related to 40 CFR Part 62 and 40 CFR Part 63 relate to federal requirements around air quality, which has a connection back to odor nuisances. The item B on the second page, when the gas collection and control system is required, obviously, that it's pulling from all areas of degradable waste, meaning all sections, not just including the closed section. And because we know gas collection systems can fill in with silt or water over time, the following items in there all relate to how do you monitor and maintain that gas collection system so that it works as effectively as it was originally designed to work. And then, you know, the steps that they would have to take if the one or more required wells don't achieve that required that level of performance, what they have to do. The process for correcting those are not overnight corrections. So that's the purpose in this section where it talks about IDing those and monitoring those over time, because some of those fixes are not quick and immediate. So there are things that would take time in some cases to address. And then the last condition relating to the PCB and hazardous waste prevention and detection program. The facility does have an existing PCB and hazardous waste detection plan. It was last revised in February 2011. And so we're proposing a requirement that within 90 days, basically within the first 3 months of 2023, that the plan is updated so that it includes, but it isn't limited to the sections that talk about incoming waste trucks, but also addresses waste coming in through rail car. So those are the proposed conditions that we worked through as a group with our consultants. Those were submitted earlier this week to Sunny Farms. I did receive a response back late this afternoon, which I didn't expect to get today. And I have copies of that for you, and I've already forwarded it to you as well. These sections, this is just the letter portion of it, not all the attachments.
Oh, this is the reply.
Yes, this is a reply. I did not expect a reply today. I talked with Brian Giesecke, but I didn't expect a reply back. So this is the reply. If you want me to read, I can, so that the public knows what it says.
Yeah,
or-
basically, Sunny Farms has received the conditions, the licensing conditions that are proposed. And now replied in the letter, but literally just got it right at 5:10 or 5:15 today.
Right. Yeah.
So I haven't had a chance to even
Yeah,
read
and
this.
read Go ahead and read it.
Go ahead and read it, yeah.
Okay. So this is addressed to me as health commissioner. The subject is annual operating license renewal for 2023 for Sunny Farms landfill, CID 37706 in Seneca County, Ohio. Dear Ms. Goon, Win Waste Innovations, or WIN, submits this letter in support of its application to the Seneca County General Health District, abbreviated thereafter as SCGHD, or the board, to renew the annual operating license for Sunny Farms landfill, hereafter referred to as Sunny Farms or SFL, for 2023. Ohio law and the full array of facts, its FFL dictate that the 2023 operating license must be issued presently without conditions. On November 30th, 2022, I spoke with you by phone to inquire about the status of the board's approval of Sunny Farms application for our 2023 operating license. You expressed uncertainty, but advised that the board expects to conduct a meeting on December 29th to address the matter. On Tuesday, December 13th, 2022, you provided me via email with a set of potential conditions to our 2023 license to be considered by the board in upcoming meetings. With your comments and the proposed conditions in mind, SFL has decided to address a number of issues to the board in advance of the December 15th and 29th meetings. As you and the board know, SFL is in full substantial compliance with the terms of its Ohio EPA solid waste permit to install the consent order issued by the Seneca County Common Police Court on July 26, 2019, and all other permits and obligations arising under chapters 3704, 3714, 3734, 3745, and 6111 of the Ohio Revised Code. And you did receive a copy in the environmental health report, a copy of the letter from, or the email communication from the Ohio EPA Northwest District Office, indicating that they are in substantial compliance with the requirements. The board's environmental consultant, Mr. Chris Lund, step back sentence. SFL superior compliance performance is documented in part in detailed reports that SFL sends directly to Ohio EPA and the Seneca County General Health District monthly. The board's environmental consultant, Mr. Chris Lund, expressly acknowledged Sunny Farms compliance in his May 17, 2022 presentation to the board when he stated, quote, we agree they have complied with the consent order and the license reporting requirements that has occurred over the past 3 years, end quote. In addition, Ohio EPA reconfirmed Sunny Farm landfill's compliance status by way of email from Mike Reiser to Laura Bob Robinstein, dated November 23rd, 2022. In the email, Ohio EPA stated that, quote, Division of Materials and Waste Management does not have any outstanding violations or enforcement that would preclude the Seneca County Board of Health from approving the 2023 license for Sunny Farms landfill. Currently, and this is bolded, Sunny Farms landfill is in substantial compliance, end quote. A copy of that email is also attached to the full version. The permits issued to Sunny Farms landfill by Ohio EPA require the facility to comply with all applicable rules adopted by the agency pursuant to its authority under Ohio Revised Code 3704, 3714, 3734, 3745, and 6111. Ohio EPA is the exclusive authority with respect to permit issuance in Ohio and is the sole authority to determine what is substantial compliance with applicable rules. Furthermore, Sunny Farms landfill is required by the terms of the consent order to comply with obligations far more stringent than currently applicable solid waste management rules. The extraordinarily stringent obligations to which Sunny Farms landfill agreed in the consent order were crafted to address a unique set of circumstances at Sunny Farms. Those circumstances no longer exist. Nevertheless, all available data prove circumstances. Whoops, excuse me. I gotta make sure I'm losing lines here. All available data prove that Sunny Farms landfills, 1, landfill gas management and control, and 2, odor migration prevention are effective to a remarkable degree. Sunny Farm landfills superior compliance performance will ensure continuing success in this regard. Also, it must be noted that absent voluntary agreement by Sunny Farms landfill, many of the very stringent obligations as accepted in the consent order are far beyond Ohio EPA's authority to impose unilaterally. Most importantly, Ohio EPA has established that Sunny Farm landfill's compliance with the terms of the various permits to install issued to Sunny Farms landfill ensure protection of human health and the environment in the vicinity of the landfill. See Ohio EPA response to comment numbers 26 and 27 of the Sunny Farms landfill permit to install number P01288797. And there's a link to that. We understand that the board has hired a well-known and highly respected Ohio environmental lawyer, Joe Durham, to advise the board on whether there is a legal basis to deny issuance of Sunny Farms annual operating license. Mr. Durham presented findings and gave his legal advice on video to the board in its June 2022 meeting. A copy of Mr. Durham's PowerPoint presentation and his expressed legal advice is accessible at this link, as noted. Mr. Durham, during his presentation, advised the board on Ohio's statutory and regulatory authority governing the board's actions. Quote, under the administrative code sections, you shall issue the license if the operator is in substantial compliance, or as it says here, there's a legally enforceable schedule through the issuance of an administrative consent order or judicial consent order to attain compliance with Chapter 3704, which is the air pollution control laws of the state of Ohio. 3714, construction and demolition debris. 3734, solid waste and hazardous waste. 3745, the EPA's authority, and 6111 of the revised code, which is the water pollution statute from the state of Ohio. End quote. In fact, Mr. Durham advised the board that, quote, essentially you are going to get another application renewal of the license. I see no basis to deny a license renewal application for operation of the landfill in 2023, end quote. Mr. Durham's comments are summarized in an excerpt from his PowerPoint slide presentation as shown below. In the section that is shown, it says licensing options for the board. At least at this stage, unless circumstances change in the next 6 months, I see no basis to deny a license renewal application for operational landfill in 2023. The landfill representatives, your consultant in Ohio EPA have all indicated that Sunny Farms landfill is currently in substantial compliance with the consent order. A copy of Mr. Durham's entire PowerPoint presentation shared at the June 2022 board meeting is attached to the full email. Based on all the circumstances set forth above, it is clear that the board is compelled to approve Sunny Farm landfill's application for its operating license for 2023 presently without condition. Furthermore, in light of all the circumstances associated with Sunny Farm landfill's operation of its landfill, Sunny Farm landfill believes there are no conditions the board might attempt to unilaterally impose to the 2023 operating license that would meet a lawful and reasonable standard. However, Sunny Farms landfill is free to agree to take certain actions in response to a request by the board. Such agreement would be on a voluntary basis outside the context of the annual operating license. To that end, Sunny Farms landfill will consider and discuss with you the details of proposed condition number 1. We may ultimately agree to execute some of the tasks outside of the operating license process as specified in that condition 1 proposal. With that said, the entirety of conditions 2 and 3 are, for a myriad of reasons, inappropriate for inclusion in the annual operating license issued by a Board of Health primarily because we are already subject to strict regulations promulgated by the Ohio EPA. To summarize, 1, Sunny Farms compliance with regulatory requirements applicable to the landfill. 2, Ohio EPA's recent confirmation in writing that Sunny Farms is in substantial compliance with applicable Ohio EPA rules and the consent order. 3, statements by the board's attorney, Joe Durham, confirming that Sunny Farms license must be renewed. And 4, Sunny Farms compliance with landfill gas control obligations far more stringent than applicable rules in total compel the board to approve Sunny Farm landfill's 2023 operating license application presently without condition. Thank you for your review and consideration of these comments. Should you have any questions, please do not hesitate to contact me at his phone number. Sincerely, Sunny Farms Landfill LLC, Brian J. Ezek, professional engineer, vice president, landfill. And then all the various items that he, yeah. And then I do have a copy of it. You'll see all of those enclosures. They're also attached to the item that I forwarded to you. So that was the response that I received that I did not anticipate getting today. And I think that's the conclusion of the information that I had to share during my report.
Comments or discussion?
What that would be,
Oh, one at a time.
sorry, but that would be stuff that we would handle at the meeting specifically for
Yes.
that, correct?
True, but I just make sure if there's any
Yeah.
questions right now about what we just learned.
I was asking my colleagues.
And we make sure that this is publicly put out. Posted for public insurance.
Okay. Very good.
We can post the post condition.
We can put the conditions out plus the reply, it makes sense that way,
Yeah.
yeah, the whole story. All right. Interesting. To say the least. Next item on the agenda, personnel actions. We've got an approved personnel action, so I have a resolution here. Quickly. Resolution, it's 2022.25, resolution to hire employee, whereas in order to comply with the set policy dated May 26, 2006, the board reaffirms by resolution the hiring of the following employees. Sarah Cloud, part-time public health nurse number 2, effective December 19th, 2022. Yeah, looks like we have to take a vote on that. Okay, everybody in favor? Aye. You got any nays? Hearing no nays. Oh, that's
Oh, you
right.
got
Get
it.
motion. You guys got a motion? Second? Okay. Say aye. Yeah, well, okay. Thank you. Sorry. Next item is policy actions involving condemnation orders. And I've got 3 properties right now listed. The first being 422 North State Route 4, Attica, Ohio, 44870, owned by Jake and Kathy S. Corney, same address. Number 2 is 1748 North Union Street, Fostoria, Ohio, 44830, owned by Lakeview Loan Servicing LLC, out of Coppell, Texas. Okay. The third one is 1101 South Wood Street, Fostoria, Ohio, owned by Calvin Chansey, same address. There is any questions on those properties or discussion on any of that? You see the pictures of that. You get a motion? Move. Motion. Second, anyone? Okay, thank you. And a second. Everybody in favor? Any nays? Hearing no nays, motion passed. Well, the other one is a rescinded condemnation order, and it has to do with 7343 North Township Road 75 in Green Springs, Ohio, 44836. still in William A. Hughes' name, who's deceased, but the same address. But there's an order to rescind, and I believe we received a letter from an attorney concerning that property. Yes. Any discussion? You get a motion? Motion to approve. Second? Second, okay, thank you. Everybody in favor? Thank you. Any nays? Okay, hearing none, pass. Thank you. Next, item on our agenda is the financial transactions, and this involves the payment of bills. We have a list of those. Will I find mine also? Okay. Expenditures. Is there any discussion on the payment amounts that are shown there? Expenditures we've got going on. No major, like huge dollar. Well, the largest one has to do with HSPS installation for $33,274. Then we can tell them that. Okay, no discussion. Get a motion to approve the payment of bills. Thank you. Second. Thank you. Everybody in favor? Any nays? Hearing none? Pass. Thank you. Next has to do with cash advancements. And there is a lot of, quite a considerable amount. Yeah. I'm gonna do this. The first one has to do with $38,000 from the general fund to public workforce. And after that's 20,000 general fund to the public workforce. So we've got a lot of transfers of monies at the year of end here to balance the books, as I understand it.
Right,
Correct.
so the cash advances are, we only have one unrestricted fund, which is the general funds, but
Right.
the other special grant funds need money to operate until the payment comes in. That's why you do cash advances, and then when the money
Okay.
again comes in, you do a cash advance and pay back.
Pay back.
everything.
Got it. We have two advances, 38,000 and 20,000. And then the next items there were listed are called cash advance repayments for 25,000. So money moving back and forth, and then intra-fund transfers. I'm just going to, there's a list of 17, and rather than going through all the account numbers, I'll give you the dollar amount so people can hear what's going on. $2,500 for HSPS contract services to HSPS salary. That was 2,500. The next one's $187.50 for public health workforce grant travel. And it's going to public workforce HSA. We got $830 from solid waste salaries to solid waste contract service. $500 from solid waste lease to solid waste contract service. $322 from solid waste workers comp to solid waste contract service. Three transfers in. $348 from solid waste hospitalization to solid waste contract services. $500 from water system leases to water system salaries. $200 from water system other expenses to water system salaries. $60 from water systems workers comp to water systems hospitalization. $17,000 WIC transfers out to WIC salaries. $1,800 were from WIC software license services to WIC PERS. $150 from the C and DD leases to C and DD salaries, $150. $65 from get vaccinated salaries to get vaccinated hospitalization. $10 from COVID-19 vaccination salaries to COVID-19 vaccination hospitalization. $50 from HSPS leases to HSPS Medicare. $15,000 from the general fund to general fund advances out. And $20,000 from the general fund salaries the general fund advances out. Okay, that was all the transfers listed there for intra-fund. Are there any questions on those items? Before I go to the supplemental thing, I thought we one side. Yeah. Any discussion? About the amounts, dollars, okay, end of the year? Okay, let's do the cash advance repayment first. Oh, cash advance basically, yeah. So the first piece will be the cash advance of the 38,000 amount and the $20,000 amount. And then the $25,000 amount repayment, maybe we do all that together. Make a difference? Okay, it's all cash advance. Okay. So those three items, the three big tickets, essentially. Can I get a motion to approve? Sure. Thank you. Second? Thank you. Everybody in favor?
Aye.
Any nays? Thank you. So the cash advance and cash advance repayment motion passed. Next item would be the intra-fund transfers. Those items, those 17 items, the dollar amounts in there that are moved between funds.
No, within a fund.
Within, I'm sorry,
It's only
within,
within a
well,
single
we're
fund.
within a single fund, different
Yeah,
parts of it.
different lines.
Yeah, your different line item. My mistake. Thank you. Thank you. Everybody in favor?
Aye.
Right, thank you. Any nays? Motion passed. Next, agenda item is supplemental appropriations. Yeah, I'm gonna have, somebody has to explain these funds, what's going on here. Sorry,
These are, those are basically end of year adjustments. These are all grant related. Money, expected this year, not spent this year. So I have to reduce the appropriations and then it can move into next year's budget. Basically, so. It's not like we lost any money, it's just not gonna use this year, we'll move into next year.
so this amount's being shifted to this coming in.
They're just reduced appropriations.
Okay,
Appropriations that we haven't spent,
okay,
and they're gonna be spent next year, hopefully,
Right, so the auditor requires you to.
adjust them down.
Adjust.
just accordingly, because they're for next year now. Okay,
They're going to be.
any questions on that? Okay, the amounts, I'll read them out. First is the Get Vaccinated grant for 26,000. Next is integrated naloxone grant for 2,000. Third is COVID-19 enhanced operations grant for 78,000. The fourth is a public health emergency preparedness grant for 135,000. Fifth one, public health workforce grant, 36,000. And the last one is the COVID-19 vaccination grant, 7,000. Those are all different fund numbers. Any questions? Not gonna get a motion, please. Okay, got a motion, a second. Everybody in favor?
Aye.
Any nays? Motion passed, thank you. Next item is contract agreements. We've got two. Great Lakes Community Action Partnership for Four-Story Building Lease is for from January 1, 2023 to December 31st, 2023, not to exceed $22,523.28, and we're the payer. Building lease in Fostoria. Second one is Ohio District 5 Area Agency on Aging, Ohio District 5 Area Agency on Aging Incorporated for health assessment services. Okay, and that's for January 1, 2023 through December 31, 2023, and the amount not to exceed $4,608, and we're the pay.
And that is for the senior health clinics that we do.
Okay, senior health, senior health assessment. Good. Any questions on the contract agreement?
That's the space we rent in Foster, we're within nursing.
Yeah.
To do the services there.
Good in there. Anything else? Get a motion, please. Thank you. Second, anyone?
Sure. Okay.
Thank you. Everybody in favor?
Aye.
Any nays? No, not hearing none, motion passed. Okay. Next item I have, is says approved local public health service collaborative LLC fee schedule.
Right, so as being a member of the collaborative, you are under the same umbrella, so you need to adopt the collaborative's fee schedule, so this is what you have. And they're in two sections, basically. One, the first set is various different services that some members of the collaborative provide. There's a few in this list that we do. But we're asking for approval of all of them, so that if you potentially add those services in the coming year, you've already approved the fee for those.
Show everyone what
So
piece
it
we're looking
looks
at.
like this.
Yeah,
It
thank
says
you.
local public health services collaborative LLC.
There you go.
And then the other one is the fee schedule for vaccines for 2023. And so these are the vaccine rates set by the collaborative for all the various different vaccines. Again, we may not have all of these different ones, but we have you approve the whole so that if we do get some of these, we have a way of go ahead and charging for them. So as being part of the collaborative, this is the price that is charged to insurance. In those situations where they're eligible for vaccines for children program, typically children on the Medicaid program, or who don't have insurance to cover their immunizations, those are offered at just the cost of the administration fee. So these fees don't apply to that vaccine at all. And that vaccine comes to us directly from the state. We don't purchase it ourselves. And then for individuals who don't have health insurance, we are able to offer a self-pay discount. That's the way that the collaborative does it, is the way that we've done it all along, because we actually copied what they were doing when we approved that policy previously. So that policy doesn't change actually, but this just shows the full fee.
So someone uninsured.
They get a charge of less.
They get a discount.
They get a discount, yeah.
So what rate did you use before?
Yeah,
Well, we just came up with them ourselves based upon what the formulas we used, and I don't know. I don't,
I didn't bring it. I
Create
didn't bring the
rates.
formula. But it was just.
You look at the price.
It was a price, and then we had a multiplier, which is, I believe it was the same basic formula that they use. I don't remember. And remember, I put it in your packet at one time.
we did have the math.
Yeah, I had the math in there, but I didn't bring it along with me tonight.
Yeah. So these pricing are all based on a local collaborative.
on the local
Collective,
level, right, because
everybody
we're all one practice,
buy.
and we have to charge, everybody has to charge.
But it's
the same
quantity,
fee.
quantity purpose too, I mean.
Right,
or
yes,
idea.
exactly.
Okay. All right. Any questions on this? Lots of numbers.
Yeah, as I said, the
Yeah.
first section, we don't do most of these services currently, but there are some health departments that do primary care. So you'll see the full array in that, the first section, the non-vaccine kind of things. And then the second set is just the vaccines. Or like TB tests that we do, they're in that list too.
Any other questions on this one? Or are there questions on this? The numbers. Was there an assessment of pricing compared to other areas that are getting this kind of, I mean, do,
So it represents
Cost.
health departments across the entire state.
okay,
So,
that's what okay. Right,
yeah, every region has at least one health department in it, if not multiple.
okay. Any discussion? No? Yeah, any motion?
I'll make a motion to approve.
All right, thank you. Second, you? Second, all right. We got a first and a second. Everybody in favor? Aye. Any nays? There are no objections, motion passed. Thank you. So we approved the local public health service collaborative fee schedule. Next one has got to do with our 2023 annual budget.
Right, so what we're required each December is to have you approve the annual appropriations, basically what are our expenditures. And so the first page of that literally says 2023 annual appropriations by fund. And so this is the summary page of them. So it shows the 23 funds that we have. 22 of those are restricted or committed funds, which means they cannot be used for any other purpose than what it's for. Only the general fund or the Board of Health funds can be fluid, as in you can use it to do cash advances. You can do it cash transfers if you need to support some other program, but you can't do anything other than a repayment of a cash advance from those other funds. So the one of those restricted funds, the Seneca Health Alliance, which is third from the bottom on that whole list, that's a custodial account. So it's actually, we're holding those funds on behalf of the Health Alliance that does the community health assessments. The Health Alliance actually budgets or puts in contributions, members put in contributions every year, so that when we get to the end of the 3 years, we're able to pay the fee that it costs us to do the community health status assessment. So those aren't funds that we really do anything with other than hold them for the alliance for the purposes of status. So you can see there, the total is $7.87 million, which is an increase from last year. Last year's total was $6.09 million. And there's a couple of those funds that account for that difference. But for the public's information, I'll go through the various funds and what the appropriation or the expenses that we've budgeted for. The details of where we appropriated those funds, like how much in salaries and how much in supplies and how much for contracts, et cetera, are all in the following pages for you by funds. So Fund 7033 is the swimming pools fund, and the total appropriations are $8,767. That's a relatively small program. The solid waste fund 7034, the appropriations are $58,334.49. Fund 7051 is the manufactured home parks. Basically, we are contracted to do inspections of the manufactured or the mobile home parks. So that's a payment we get. It's a contract basically that we get from the Manufactured Home Commission. And that's a total of $9,750.50. And then Fund 7060 is the Board of Health Fund. That's $1,748,050. 7062, the Water Systems Fund, is basically for the private wells. That the whole operation that we have related to that, the installation, the inspection, all of that, and that's $30,041.69. Fund 7067 is the Food Service Fund, which is pretty obvious. All the food service operations, retail food establishments that we're responsible for licensing and inspecting. That one is $140,285.05. The Joint Solid Waste Fund 7069 is $65,286.23. I mean, all of those, except for the general fund, all of those are the source of revenue for them are environmental fees. So that's why they're restricted, is because by statute, the law says that you can only use those for the specific program that you're looking for. 7081, the senior program, is exactly what we just approved the contract or the agreement with the area agency on aging. So it's our senior health clinics that we do, $7,210.55. That's obviously different by a couple $1,000. We supplement the cost of doing that. The grant does not cover the entire cost of providing that service. Fund 7082, the WIC administration grant, that's $338,612.10. So that one's rather self-explanatory. That supports our entire WIC program and staff. Fund 7089, construction and demolition debris, $3,360,302. And though that reflects, our expenditures related to the construction and demolition of the municipal solid waste landfill. So much of those expenses are, what's the right word? Remittals to the state, to various entities at the state and at the county and at the township level. That's the majority of those funds. 7092 is the Get Vaccinated Ohio grant. That one's for $37,415.60 are the expenses we're budgeting for next year. Fund 7096 is the Integrated Naloxone Access and Infrastructure Grant. And we budgeted for $41,279 in expenses next year. Fund 7120, the COVID-19 Enhanced Operations Grant. We budgeted for $367,770. And then 7130 is the Medical Reserve Corps. That's a grant that you approved last month from the National Association of County and City Health Officials to help establish or reestablish our Medical Reserve Corps, to help us in emergencies and promoting, helping us with a variety of health promotion types of activities where additional personnel would be helpful. So that's for $50,000, the amount of the grant. Fund 7141 is for nuisance abatement. That's $21,251.75. And Laura, is that the one that we use that for?
It's really there for demolition.
Yes, thank you. Yeah, demolition of properties you condemned. Yeah. Then we have 7142, which is the Public Health Emergency Preparedness Grant. That one's $122,090. Fund 7143, the Public Health Workforce Grant from the Ohio Department of Health, which is actually a pass-through from them. They get the funds from the Centers for Disease Control and Prevention. That one is for $197,892.93. And we've created several positions that are funded primarily from that grant, which is intended to increase the capacity of local health departments. And then Fund 7145 is a COVID-19 vaccination grant. We've budgeted $79,164.30. 7150 is the COVID-19 detection and mitigation in confinement facilities grant. That is a new one. That's $740,000, and that's fund that almost all of those are passed through to the county jail and to Crossway Community Correctional Facility, or improvements in their facilities that will reduce the ability for communicable diseases to spread in their facilities, to reduce exposure of staff there to somebody else that is infectious there. So it's a path through almost totally. So Fund 7164 is household sewage treatment systems. So that's $403,000 to $403,222. And that includes the funds that we receive from the state to be able to offer the subsidized installation replacement of failed systems where homeowners apply and they can receive a discount based upon their income. So it's designed to improve water quality across the entire state, but here specifically in our water systems. The Seneca Health Alliance is 7165. That's $20,200. 7182 is the WIC-led testing contract. Those are funds that we carry over basically from year to year. That contract has not been in place for a while, but we slowly use those funds. $9,680.76. And then the final one is 7190 for termination benefits. We use those funds when we have people who retire and they qualify for payouts of a portion of their sick leave. So that's the total, and you can see down below then in the bottom half, where do those various funds come from? So where are the revenues? So 25% of the income that is reflected there comes from grants. So if those grants did not exist, we would not be able to provide those services. The general fund accounts for 22% of the total revenues. The environmental fund, 52% comes from the environmental funds that are fees that the individuals pay for all those various different services, including fees that the landfill pays. Contracts, you can see there is less than 0.5%. Custodial funds also less than 0.5%, and miscellaneous also less than 0.5%. To come up with our total budget of $868,285.73 for 2023. I mean, you can see from the pages that follow, specifically how we, spread those appropriations, those costs out throughout for each grant fund or each fund. And that reflects a whole lot of work that Anita has done. A lot.
I know this is probably not a question you should be able to answer, but theoretically, how does our budget compare with how many other health districts? I don't know how to, I'm sure you might.
Yeah. For our size, for our county. Yeah.
Exactly.
Yeah, I mean, and then the other piece you have to take into account is many counties do not have landfills, and that significantly impacts that. As well as, I know, did a comparison back several years, counties that still have home health and hospice agencies, theirs are also significantly different, but I can get that information. To at least some degree. If you'd like, I can get that for you. Yeah, because that would be interesting to know. Yeah, exactly.
For one,
Offer what we can.
the one fund for construction demolition debris is 3.3 million out of the whole amount. So that's a big chunk.
Yeah, it's a big chunk.
Big chunk.
But it can only be used on things related
Due
to
to
that.
that, exactly. Well, that's specific.
Yes, they're very specific.
Gotcha.
What's our budget compared to last year?
Last year's budget was 6.09 million. So those increases, well, some of them are up and some of them are down, but those increases, for example, are the $740,000 for the confinement facility mitigation grant. That's totally new. The construction demolition and debris is up about $1 million from last year, what we're budgeting for, anticipating this year versus what we had appropriated last year. So those are the two biggest sources of the difference between last year's amount and this year's amount. And the others are some of those other COVID grants. The WIC grants up some, all those various ones have. They're usually up a little bit, but some are down too.
What is the COVID-19 enhanced operations?
Right, so that grant specifically is for things that we do to do outbreak investigations. So we currently have 3 facilities that have COVID outbreaks in them. And they're typically settings where high-risk individuals. So if they get COVID, they're more likely to have severe illness. So it pays for the investigation, and that's where the contract with PCG, Public Consulting Group, to do the contact tracing is in that grant. That's probably the biggest line or the biggest expense in that grant fund. Also, some things that internally we can use it to provide masks for our staff, to implement other things that help prevent spread. So, for example, we're looking at getting HEPA air filters because we have many staff all share one office space. So it's for things like that too.
Other questions? Any discussion? Hearing none. Let me get a motion on this budget. Been a lot of work involved here, you can see. Going back through, looking at the detail, and the breakdown of things. Appreciate that.
I think this is kind of a document that you should keep on the first part of your file, so that you can look at the total and then go back and look at the sheet and
Yeah.
where, what kind of thing have to be provided by that fund.
Exactly.
Right, and the appropriations that you approve aren't necessarily what they end up being by the end of next year, just like we just
Right.
Yeah.
reduced appropriations for 6 or 7 of those funds. So, they're intended that this is what you think you're going to spend based upon what you have coming in. So for some of these grants, those funds are only for 6 months, or they're only for 9 months. So like WIC, it's an October 1 to September 30th, but we can only
Yeah.
budget for what we've actually been awarded.
Yeah.
So it doesn't include the last 3 months of the year. So, and that's true for any of the grants that change in the middle of the year.
Right.
I'll make a motion to approve the budget. Thank you. We have a motion approved. Do I have a second? Thank you. Everybody in favor? Any nays? Hearing none, motion passed. Thank you for all the hard work that you do on here. Just a point of fact, I was looking at the fund related to Sunny Farms 089. And for the public's information, I'm just gonna, the one item I just struck me was contract services, which involved the hiring of our consultants. The professionals that are trying to help us, what should we do? And let me see, current appropriations, yeah. Current appropriations were $325,000 for consulting fees, I guess is what I would consider that to be. That's going up to $350,000. So we increased it just a little bit, but we're sticking at it because we need to get that input from professionals that know about this, since I, for one, am not an environmental expert. So thank you. All right. Budget 2023 budget. Next item would be the election of the 2023 board officers.
Mr. President, I
Oh.
have a motion. to
Okay,
rescind, to rescind, 2022.19 was brought up at the last meeting. It ended in a tie. I have, further information I just wanted to pass around to the board. That's it.
Is that the thing decided in executive session?
Actually, this has been brought up twice in public comment.
I
So-
know, but as long as no public willing, it's gonna happen like it did last time. It's gonna be weird. You were, you didn't get to experience it.
no. And it's one of those things where that's why I was questioning executive session, need of executive session.
Related to a component that's not practically what this board and her position is above and beyond things. It's not necessarily bound by executive session, which is being voluntarily asking, voluntarily approved on the sexual role. It is outside the scope of the job.
Right, it's outside of the typical scope of contract, it wasn't a defined scope of work or something that was asked for. Right, I understand that point. It's just that I was pointing out the any claims or complaints to public officials, that type of thing. A lot of times suggested by sunshine law to be done in executive discussion in executive session and decisions made in public.
Different things from different groups. I just wanted to reintroduce that, and the information that I did receive from, should I read it? What should I do now?
Well, I don't know.
What I would like
You
to
guys,
read,
yeah,
well, the concerns were the taking away from our health department. And
Okay.
what I've gotten from the health commissioner's activity report summaries, I'm just gonna give the summary. From July to October, in 4 months, this is prior to asking permission to spend time out of, for this project. From July to October, 4 months, the health commissioner attended in person or virtually a total of 46 meetings, according to the health activity report. 26 out of 46 of those meetings, or 57%, were for the Association of Health Commissioners meetings. This is prior to asking for permission to devote more time in association. Already more than half of these meetings are related to AOHC. So these are what have been brought to my attention by people that have looked it up, and it's all on record.
We know the time of the meetings, and we like 12 meetings,
I
like
just
10
know
minutes,
that
or is that an
more
hour?
meetings have been going towards that than other things. But,
I'm just saying, do we have like a context, of how much time that is? I mean,
Yeah, what's the involvement, everything.
What I'd like to know is the new people that are part of the board now, is there an understanding that the board has supported the health commissioner position in general in the past of being part of the AOHC? I mean,
The previous
that is
health
something.
I'm saying this is what we're paying for, we're paying another, to do another job other than the Seneca County.
Well, should it also matter to staff and how we feel about it? If we think that she's being taken away from the position?
This is a professional
I know, this is a
organization.
professional
Yeah.
organization, but yet we're spending up to how much to go of the taxpayers' funds to do this.
I'm part of like 3 different professional organizations. Are you part of any?
I am, but you know what? I don't spend 25% of my time
It's,
in
but
getting
it's
paid by
talking-
someone else to do it.
it's talking about.
It is my, well,
I just try to, I just think that personally, as an employee here, that what occurred,
This
no,
was-
let me talk, thank you. What occurred last time at the last meeting was inappropriate and how it was handled.
okay.
And I also feel like that you as a board member do not support the rest of the staff members, because if you did, this, how it was handled at the last meeting, would have been how it was, should have been done in executive order.
Well, I feel that it should have been sprung on all the new members of the board that they just were thrown into their first meeting by appropriating funds from the public to have our director who says she's overworked and overtaxed as it is, then
Again, shouldn't have been handled in an executive meeting. I don't think it should have been done in front of it. Probably made the rest of the staff members uncomfortable as well. When you are attacking a health commissioner,
I'm not attacking the
like,
commission.
really?
Yeah, I make a motion, we move into executive session. I make the motion.
It's a reason.
The reason is to discuss the personal, official person in public, what they're, I'll get the exact wording, performance of person in public. We have it right here. To consider any employment, dismissal, discipline, promotion, demotion, or anything concerning the public official is why I would like to go into executive session.
Mr. President, what's being asked is something that's above and beyond the contract between the commissioner's position and this board. The role that's being taken on is above and beyond the contractual obligation and this relates to things discussed.
Okay, everything that I've read in Ohio sunshine laws have said anytime that you're going to make complaints or charges against a public official, that it's appropriate to do an executive session.
I've not heard a complaint or a charge. What I've heard is a discussion of the question of hours being delegated to a task that's outside the scope of contractual agreement with the board.
The way you presented it was as a complaint.
A complaint, yeah, is what I kind of got.
We have a second. We have a vote to go.
Yeah, we have a first and a second on executive. We can vote on it.
Do the roll.
Okay.
I'm sorry.
I did first.
Kind of both of us did it.
Okay, okay.
First and a second. Okay, take a roll call.
Dr. Akers,
Yes.
Mrs. Bora,
Yes.
Mr. Watson,
Yes.
Posey, Mrs. Vitt, yes. Mr. Watson,
Yes.
Dr. Russ, and Dr. Will.
I'm the agent on
Six,
this.
4, yeah.
Okay, we go into executive session. Decided. So with that, executive session, so at that public, please leave, we can have our discussion. You will reconvene. No decisions are made in executive session. Okay, that's a motion. We gotta get the meeting resumed first, wait. Fine, we gotta get going again with the supporting. Okay, but we're on record? Okay, we're back in a public meeting, not an executive session. Thank you. All right. There was, go ahead.
Are we able to make a motion on what we discussed?
That is the purpose of coming back into public meeting, is when we make a decision.
We can back in.
Yeah, exactly. So now that we're back in meeting, we had a motion. I don't know if you want to restate your motion. Or,
To rescind. Resolution 20. 2022.19.
.19, okay. All right. Here's a second.
Do we have a discussion as far as asking?
Oh, I'm sorry. Discussion.
I'll second it then, we can discuss.
Okay, we got a second then. Discussion. Yeah, motion to rescind 2022.19, which was authorization for the Director of Health to participate in the AOHC as Vice President and part of the board for 1 year.
We're gonna call roll on
We're just opening it for discussion.
Open it for discussion right now. You guys got a motion out. Yeah. No discussion.
I think there needs to be a limitation set on it,
Time limitation. You have a motion.
lower the limitations, and maybe increase the expectation that that the local meetings take precedence.
So do you have an amended motion? Do you have amendment to the motion? Oh, you have to state it.
Yeah, that the hours are decreased, the max hours are decreased to 20 hours.
Okay. So rather than rescinding, you're suggesting reducing the amount of involvement hours wise,
The max.
maximum. Okay. Any thoughts? Any discussion?
it. To me, that's very.
Okay.
You say an increase involved in the local.
Yeah, just make sure that, I don't know that you can put that in. You put that
It's
in
not
there.
really in that.
Yeah.
Just.
I will, if you're gonna amend to be an increased involvement, agree that she will take precedence on the local issues before the spot down the statewide issues. But if there's a local meeting that conflicts or a local entity that conflicts, that will take precedence always over the state association.
Okay. Over states, okay. Does everybody understand the motion that's in place right now? Okay, is there a second to that motion?
I'll second.
Okay, got a first and a second. You take the call, a roll call vote on this case.
Make further amendments on top of that, or those need to be,
Okay, you,
does it need to be voted individually, or how?
no, go ahead if you have another change. So far, 20 hours and takes precedence, local takes precedence over the state.
I would like that if the board has a stance on a vote, that it be voted that way at the AOHC level as well.
That's the part where she's suggesting that those decisions, local decisions take precedent over.
It's totally different.
No, it's more like local meetings. I mean,
That was.
My-
that was the vote
yeah.
reading.
Oh.
What I'm saying is that if the board takes a stance on something, she can't go to AOHC and make a different stance because of her personal opinions, because it needs to be representative of the county.
Right, you're saying don't abstain.
Correct.
Okay.
If we're taking a stance, then the stance should follow through to support our county stance.
So maintain the county position stance.
Yes.
Okay. All right. Any other discussion? We've got the motion that's been modified a couple times, so any other discussion? Okay. So far, try to summarize, make sure I get this right.
Motion.
The motion to rescind, but actually is to say she would participate as vice president of the board for a year with a 20-hour per month limit. We'll take precedent local over state meetings, what you were mentioning as far as location.
Yes.
And then maintain our position as a county has precedent over AOHCs. So she would not just abstain, she would vote the way we would want. Is that clear?
No,
Do you think those things are attainable?
Okay. All right. Are we ready for a vote? Yeah, please take a roll.
Dr. Akers,
Yes.
Mrs. Laura,
Yes.
Mr. Logston,
Yes.
Mrs. Posey.
Yes.
Mrs. Vitt,
Abstain.
Dr. Watson, I'm sorry, Mr. Watson, Jesus.
Got it. Phone. And you.
So Dr. Wolf.
No.
5-4.
5-4, okay. So the motion passed that she's involved with the AOHC as a VP board for 1 year with a limitation on hours per month. President with the local meetings over state meetings, and then maintain our position and not just abstain on decisions at the AOHC. Okay. Thank you. All right.
And an item for a new item that I'd like to propose, that I think would help mitigate some of the issues that we encountered here. It would be a motion to adopt a health commissioner performance evaluation that would be conducted annually. And it would be very commonplace of what is in the private business, if you will, a 360 evaluation. There'd be components that would be a self-evaluation by the commissioner. Evaluation by this body, evaluation by key stakeholders. And then evaluation of the staff. And there'd be different domains that be included, including quality of work, quantity of work, adaptability, dependability, cooperation, and judgment. And this would be administered by the president of the Board of Health, and then we would get this information back and review this at our February meeting each year. And we'd have the February meeting and the March meeting each year to discuss the evaluation.
Yeah, she has evaluation that's done every year by the board for the contract already, so you know, it wasn't something we just didn't do, so you're aware.
The board doesn't.
Board, yeah, board evaluations.
What domains does it include?
I don't remember right now, because it was last year when we did it, and I only went through it the one time so far in my career. So I'm just saying, there's something evaluation is already in place,
So
so
when will that be done? That's,
it's a good
I
question.
think it's prior, I mean, I think it says annual.
At the beginning of this coming year, yeah,
I see
we
the
did it.
contract, and see the evaluation will be done, that's per her contract. My
Yeah.
thing is an adoption of a detailed procedure on this evaluation, performance evaluation, that
Okay.
includes these domains.
Yeah, this is
Do
no
we have
problem.
a copy of the previous evaluation? Not like form, the generic form that's used for that.
Yeah, that's a good question. I can't say, I have.
Obviously, her evaluation would probably be in her file.
Could be a
whatever
file.
that is.
That'd be right. That's right. And we have to go to, I'd have to look that up. I have to go to the office to find that, to do that. I have no problem with having to form a system. Makes sense for evaluation. A worksheet, so to speak, that makes. That's what I
This
see.
evaluation process.
Yeah.
Self-evaluation.
There's nothing unusual.
Right,
about that.
evaluation by the members of the board, evaluation by staff of the health district, and then evaluation of key stakeholders that the Board of Health is involved in.
Okay.
I'd like to make a motion to adopt this performance evaluation as the standard for our evaluation of the health commissioner.
Yeah,
And
If we already have a form.
Does our current evaluation process?
I don't know. Obviously, it's a once a year format.
Yeah, it's a once a year thing, so like, yeah.
Can we table this to get the copy of the blank?
So what's been happening, you know, that might be a good thing to look at.
We could even do it at the 29th meeting at the beginning.
Oh, it's not. We got one decision to make.
Yeah, we'll do it on.
Yeah.
Do it again.
Yeah.
Can we get a copy of it, and send it out?
That would be the best thing, I think, if we did prior years performance evaluation, get it to everybody. So that we can all look at that too. I have no issue with, with standardized methodology so that we all can look at it and do.
I guess that's my question. If we have an advanced copy, could we vote on it on the 29th was my question. Just to
Oh.
get it in and then it's done and.
Correct.
It could
There's a
start in
timetable-
January.
There's a timetable with this that would happen each year.
Yeah,
Get disseminated in January to the stakeholders, to all the individuals that we perform the evaluation. There'll be a timetable that this would be gathered by the board president and then discussed by the board at the February meeting with the opportunity for the March meeting to be added time if necessary to discuss the evaluation process, 360 evaluation.
okay. I see the procedure listed here, yeah, the whole procedure. Yeah.
When to disseminate.
Uh-huh.
I make a motion that we get a copy of the prior and then vote on it at the 29th.
Like a second. Sure. First and a second, everybody in favor of getting a previous copy and then deciding this on the 29th.
Aye.
Everybody in favor? Any nays?
No,
Okay, one no.
do the roll call.
Do a roll call, please.
Dr. Akers,
Yes.
Mr. Cora,
No,
Mr. Watson,
Yes.
Mrs. Posey, Mrs. Good, yes, Mr. Watson, Dr. Cook,
No,
Dr. Dana,
No.
I think it's easy to say.
and Dr. Wall. So I have 5 votes, 4 and 3.
Okay. It passed. The motion is passed that we will get the previous evaluation form to everybody to see, so we can make a decision at the next meeting. There's only gonna be 2 topics, and that's one, that's the only thing I'm gonna add. So, okay. Thank you. Yeah, now we're up to, boy, past 8 o'clock. And we're supposed to be out of here by now.
I talked to Kathy and she said it's fine if you go over.
We're okay? All right.
That's what she said.
I didn't want to get mad
She's not mad.
at
She said
me
no
in
problem.
particular. Okay, then we are up to public comment section.
did you do board president?
Oh, I was trying to ignore that. Okay, election of board officers for 2023.
I'm moving to do the same. I'll second that motion.
Me too.
I don't-
Who's the vice president? Say,
I think Scott is.
he is, but I'm asking.
Yeah.
He's not here, that's what happens.
Who would you prefer as your vice president?
It's the board decision. The board decision. The more help I get, the better. So, got a first and a second. Any other discussion or suggestions? Okay, let's take a roll call vote on this one.
Dr. Akers,
Yes.
Mr. Cora,
Yes,
Mr. Watson,
Yes,
Mrs. Posey, Mrs. Good,
Yes.
Mr. Watson,
Yes.
Dr. West,
No.
and Dr. Wall.
I don't even know how you change. I'm sorry. I should have asked that before we did the whole, like, if you have to like nominate people.
Yeah.
yeah, you could have nominated anybody.
Okay, I didn't ask. I should have asked. I don't want to be president. Or-
I have 6.
It's 6/4 of the motion passed as it. All right. Now we're up to public comments. Yes, let me do this. Please get that, too many concepts, papers, paper. Okay. We got the, we're entering the public portion of the meeting. As outlined in our public participation, the Board of Health meetings policy, the purpose of this is to provide an opportunity for the members of the public to inform the board about their views. Speakers are required to address the remarks to the president of the board. Neither board members nor staff will speak or engage in dialogue during the comment period. The board president may provide brief factual information. If I have it, I will tell you what I know. It's appropriate, but I can't enter in back and forth because I don't have enough detail a lot of times. Some of the things you're asking are good questions, but given more research would be a better answer instead of me spouting something out with just my opinion. So I ask everybody to limit their the talk or question or comment period to 3 minutes so that everybody gets a chance to talk. Please state your name and where you reside before you speak. Okay, with
All
that,
right.
please,
Susan
welcome.
Platt, I'm from Loudon Township. I'm representing Seneca County residents for open government. We have a few concerns. I have a prepared statement I'm going to read. Board members, thank you for allowing me to speak in front of you tonight. I made copies of my public comments, which I will distribute when I'm done. Unfortunately, I would also like you to make these part of the meeting's minutes. Unfortunately, many community members made valuable statements over the past year, but the minutes are not reflecting those statements. I would like to share additional examples of incompetency shown by the Seneca County Health Commissioner. In early September 2022, I requested a copy of the public notice for the August 31, 2022 Board of Health Personnel Committee meeting. The Health Commissioner failed to provide such notice to the public. For the members of the board that are not familiar with the Ohio Open Meetings Act, the law states that committee meetings are public meetings, and the public agency shall notify the public in advance of the meeting date, time, and location. Director Goon responded to my email and stated, I am unable, now this, remember, I was asking at the beginning of September, the meeting was at the end of August, and she responded to me, I am unable to provide a copy of public meeting notification for this meeting, as there was a misunderstanding regarding the need to provide public notification, since less than a majority of the Board of Health members were in attendance. So it's a little, there's a gray area there. How did she know there wouldn't be all the members there in order to have enough members to vote? I am not sure if Director Goon understands the law or if she just ignores it. That's for you to decide. But she is exposing this public organization and you, as board members, to liability due to her inept actions. This director is supposed to have director experience, as she was a previous director in another county. I do have documents from her earlier employers, and if you would like to see it, I would be happy to share those. A public meeting notification shall be released to the public days in advance. You do so to notify the public of a scheduled committee or board meeting. When you do that, you assume that the majority of the committee or board members will attend the meeting. If you know that the majority of the members won't be able to attend, then you probably won't schedule the meeting. Why? Because you cannot conduct business if you don't have a quorum. In her email to me, Director Goon clearly doesn't understand the law. I will repeat what she said. There was a misunderstanding regarding the need to provide public notification, since less than a majority of the Board of Health members were in attendance. Her answer makes no sense at all. Again, a public notification shall be released days prior to the meeting. You cannot say, well, not everybody showed up, so I don't have to provide the notice. Let me express something that is even more concerning.
3 minutes.
I have a copy for everybody,
Okay.
so I'll make sure you get it.
All right, thank you very much. Appreciate that.
Would somebody else like to read it?
There's a next public person to speak, please. Oh, I'm sorry, apologize. Jenny? Jerry, sorry, Jerry. Trying to read. Oh, nobody else requested to speak. I apologize.
I have a couple questions that's come up just from the meeting tonight. I didn't know I was going to address them. It's things I've heard.
Are you signed in
No.
Also,
There's another sheet.
She'll catch
you need another sheet, please. I just trying to make sure we have your name.
Oh, I'll sign it for sure. before I
Okay,
leave.
okay.
Okay, I will. And just two things from hearing tonight. I understand that the board has put, I don't know if the proper term would be limitations on 20 hours for this outside resource. And the other stipulations. How is that going to be monitored? I'm sure she's salaried, as most of the positions are. Will she log her days and times, or how will you, who's gonna be the gatekeeper, I guess, of that time? And again, I'm just looking at real life situations when people work, you often have to allocate what you're working on to keep track of certain things, funding grants, things like that, how much hours are spent. So how is that gonna be monitored and gatekept? I'm just asking that from tonight.
Right.
And something else I heard at the beginning, and this just spurred my, when she initially started talking about the commissioners meeting and bringing up asking for a reduction in cost of rent for the health department. I watched that video, as I watch a lot of commissioners meetings, and I guess my question is this, and I'm just making a statement. I got a sense from watching that when Commissioner Paradiso said to Tyler Schaaf, you know, they knew what the health department was already paying per square foot. She's asking for a reduction in rent. Tyler Schaaf would not go on record when asked what the other people in downtown are paying. I certainly alluded that he did not want to disclose that because the health department's probably getting a reduction in that as already, and didn't make that on public record. I know that Commissioner Kirschner asked that a evaluation be done. Do we anticipate the rates now going up since this was brought up? I would assume, since we're getting $1 million renovation already, it might not have been great timing to ask for reduction, just with, especially with the economic situations that we're dealing with now anyways. And I'm aware that some of the places downtown's rent has gone up already. So I'm just making that statement.
Thank you. Appreciate that. Anybody else?
Yeah, I'm Daniel Straub at 4084 South State Route 100. And I would like to donate my 3 minutes of time so that Ann could complete what she has been working on that you people need to
You didn't
hear.
sign in, sir.
I can't, what's that?
Did you sign in?
Jerry signed in. You wanna give me your 3?
Yeah.
Okay. Okay.
When people were in here initially, I made the statement, please sign in if you wish to speak. In order to give your 3 minutes, you had to say, I signed in and wish.
Well, you already allowed one woman to sign in after the meeting, so you already set a
Okay,
precedent.
I never saw that.
because I'm trying to be nice and accommodating, so you want to take it out of.
You have somebody that you should listen to. You shouldn't just shut off the public.
I have received all the emails. We've got copies in our folders of everything that was sent to us also. So we're not ignoring anyone. We are taking that information in hand. Now, as far as the comments and things that are going on like that, it's something that we can only consider, but I can't comment. I have no way to know.
Well, you didn't follow parliament procedure when you denied Clay the fact that he wanted to rescind that. You should have voted on that and not put an amendment on it until after you voted. You never voted on
I feel like I didn't accommodate your motion.
He didn't vote on it, Clay.
You didn't follow Robert's rules of orders. by any
How did it
means.
go?
If you need me to bring it.
You should have voted on that before you had.
Somebody else like to be the president of the board.
Pot, maybe, yeah.
Okay. This meeting is now over.
No, you have.
I am
That's what
done.
you do, shut us up.
There you, that is out of order. Do you have anything to say? I was personal.
I asked you to donate my time.
You
And,
did not sign in, sir.
okay, I'll sign in after the meeting. You've let somebody else sign in after the meeting, but I can't. I never saw the place to sign in. I'm sorry.
That's really all it is. If you sign in, it's your 3 minutes.
Okay, I'm gonna step in there because she didn't sign in, but you told.
That-
Here you go. I want you both now to sign in, her first.
Hi.
Okay, now, put your name down. Sign in. We're gonna do Robert's rules orders. Anything's out of order, I'm in trouble.
But vote on that.
You
on
need to vote on.
Okay, we're gonna vote on
Not amended.
You know what? They just decided to make me still in this seat. I don't want it. I don't want this. I don't even live in Seneca County.
Wow.
Wow, then you don't belong in that seat.
Actually, he's allowed because he's a resident.
I live in Fostoria and I'm allowed to be here because I'm a resident of Fostoria yet. And I'm assigned by the city of Fostoria. So there's no proprietary actions there. But my point is, I have no axe to grind. I get no benefit. I get no effect from this.
Do you need this back?
Yes, sir. Thank you. I appreciate you filling it out. I apologize for my hostility. I apologize. But anyone who's taking personal shots at me, I will get hostile. Okay, Daniel Straw, he wants to give his 3 minutes. You go home, sir.
May
Go
I
ahead.
go? You
Please.
okay?
Yes, it's okay.
All right, Robert's rules, let's do it.
3 minutes.
Okay, well, where was I? Upon further review, the Ohio Sunshine Manual 2022 does indicate that if a majority of committee members are present for a committee meeting, it should be considered a public meeting, and the public advised accordingly. Therefore, she knew a day before her response to me that the law states that you have to notify the public accordingly. But again, she is not being truthful with the public. I have copies of all the emails, and I can provide each of you with a copy upon your request. After I'm in her email to me, Director Goon clearly doesn't understand the law. She also contacted Mr. Loxton to ask him basically what to do. I wonder why she's asking for these things. And let me read that part. Last, with the same public records request, I asked for copies of the personnel committee meeting and my notes related to the meeting and any notes related to the meeting, as well as the candidates' names. Shortly after my request, Director Goon sent an email to President Loxton stating, I assume she specifically wants to know their stance on Sunny Farms. Director Goon referring to me wanting to know the candidate's stance on Sunny Farms. President Loxton replied, I do wonder what is the reasoning for the request. Director Goon, President Loxton, and the rest of the board, please know that the Ohio law allows anyone, even without a name, to make a public records request, and the public agency shall not question the intent of the request. Questioning the intent shows the public that you are not being transparent or that you are trying to hide something. Even more, according to the Ohio law, a person doesn't even need to identify themselves when making such a request. The reason for my request was to show you and the public that you failed to provide public notice of a public meeting. A group of citizens would have wanted to attend a meeting, but you conducted that public meeting in secret. Director Goon and you, President Loxton, you have lost our trust. Seneca County deserves better. Thank you.
Thank you. Appreciate you. What's the time?
I got a question. I'm Bill McAllister. I dropped this question to Ed. You said question should come to you. I wonder what the status is of the Citizens Advisory Committee for Sunny Farms, and you sit on that committee. We haven't met for a while. At least if there's any communications, I haven't seen them or missed them. I just wonder what the status of that committee.
There was an email from Austin that went out to that group about a week ago that I got, and you were copied on that, pretty sure. And it had to do with.
Was it from you?
No, it's from Austin. This is from Austin.
Okay.
Our environmental specialist. He sent it to the group.
Okay, I might have missed that.
Yeah, and I don't have it open right now, but he did update, gave us an update. Now, as far as when the next meeting is, in December, it's not happening in December.
So there's no meeting date set or
Not
not.
for right now, I'm getting meeting, because we got another meeting to decide yet on the licensing on the 29th. So we got another meeting for that. And we already added one item to that agenda. So that's where we're at with that, to answer your question, Bill. Anybody else? I don't want to be out of order, so make sure everybody got your comments.
One virtual comment.
Oh, there is, okay.
Ready for that?
Yes, sir.
All right, Myra, you should be able to unmute.
Hi there, can you hear me?
Yes, we can.
Hi, everyone. My name is Myra Spires, 11607 West Township Road, 108. I am one of Sunny Farms landfill neighbors. I just wanted to have on record that on November 30th, just 2 weeks ago, I had a phone call, or I had to make a phone call to the complaint number that I was getting bad odors at my house. I reported levels as high as they give me a 1 out of 10. I told them it was a 10 plus, and I just wanted to have it on record in case not everyone's aware of it, that I had readings of 23 parts per billion and 22 parts per billion on my property. The odor was coming in my house again through my front doors, creeping in through my cracks of my doorway. The odor was trapped into my garage. Every time I opened up the garage to throw my recyclables in the recycling bin, it would gust into my house. And I just wanted it on record that we're still getting affected by these gases. And I did talk to Ben Nutter, and he said that there's some kind of a thermocoupler issue and something about downward winds. And I guess we haven't had winds like that before in the last how many months. So I just and I also wanted to point out that we used to have Seneca County Health Department do readings. And I don't know if Austin is doing readings or if we're just solely depending on Sunny Farms to do readings, but I would like for somebody else to be doing the readings as well, so we could confirm that the readings are matching their readings. I do believe that they were 23, 22 because they were bad, but they're not supposed to be over 15 parts per billion that I'm aware of off of their property. And I live about, I don't know, quarter mile away from them. And I was, to me, that's violation status. And I think that that deserves a violation. And the EPA has still not responded back to me, and I've called them twice.
Thank you.
You're welcome. Thank you.
I believe we are doing testing ourselves. Austin, can I ask that question of you? Are you measuring?
Your row meters? Yep.
Okay.
I was out there earlier that day. At that time, I tested between probably 1 p.m. and 2 p.m. and there were zeros just later on in the evening.
Okay. I have noted that the complaints appear to be trending up historically. Because what they seem to like, what not seem like, what EPA seems to put their emphasis on is a trend. Something that happens, keeps happening, and keeps happening. Of a single event, they want to dismiss it, but if something becomes a trend, well, I'm looking at the complaints and they are trending a little higher over the past few months, and I've noticed that specifically.
I have a question, Mr. President, before this board and then the individuals that take these readings. In our report here, we have that there's a wind direction.
This is the public comment section. Yeah, I'm sorry, this is. Okay.
Ed,
Yes, sir.
I didn't sign in, but I will.
Okay, go ahead. All right, Bob.
Hold on to it, I'm not gonna leave. Just on Myra's comment, I drove down the road that day. I remember noting it in my own mind. The wind was out of this, about 15 miles an hour, maybe close to 20 gusting, and it was coming from the west, which was right towards her house. So, and I smelled it driving down 23, and it was pretty bad in my truck. Okay. I didn't call it stink line because I just drove through it. Probably should have. We need to have a trend here.
Yeah.
And I would be curious to find out where his readings were taken, north, south, east, or west of the landfill.
Comparatively. Okay.
Yeah, if I can get an answer to that at the next meeting, that'd be great.
Good point.
Thank you.
Thank you. Any other questions or comments? I'm sorry, comments from the public. Okay. With that, we'll close the public portion of the meeting. think that means that our motion, if I get a motion to, are we done? Okay, you can. We're out of public. Go ahead.
The question is relation to the wind direction stuff. When we get the reports that we're seeing here from the environmental division, that they're recording the winding, who's measuring the wind direction, the speed? Where's that number coming from? Is that our readings or is that coming from Honey Farms?
Which,
But like, when I'm getting the readings here, the wind direction, that there are 7 readings over 50 parts per billion, the not time that those readings were occurred and what those measurements were. The wind was 3 to 5 miles per hour out of the north. Sunny Farm noted its fouls in the report, and then they gave their note. Those wind direction speeds and that component, is that our measurements, or is that being recorded by Sunny Farm?
Those are measurements that are recorded on the stationary meters. So each stationary meter is paired with wind direction and wind speed meter.
And those meters are ours. Sorry.
Well, there's two meters that are required by the health department. Okay. And then 3 of them are required by EPA.
Okay,
Thank you.
thank you.
Anything else? Need a motion to adjourn? Or y'all want to stay? Second? Fine. Don't leave because we got a signed document. Okay, I will.